Benjamin Moshatama.
Diet health conditions such as diabetes, hypertension, and obesity are on the rise in countries such as in Kenya, but also in many parts of the world. And this is putting immense strain on already overstretched public health systems. These conditions are often driven by a high intake of sugars, salts, and just an unhealthy diet. Research scientists at the Kenya-based African Population and Health Research Center, Dr. Shukri Mohamed, says it's more critical than ever for consumers to understand what's in the food that they're buying. In a recent study, her and fellow researchers examined whether front-of-pack food labels could help Kenyan consumers make better choices. What they did is that they tested 3 types of label designs to see which one was the most effective at helping people identify nutrients of concern and making healthier purchase decisions. The results showed that warning labels were the most effective in helping consumers identifying foods with high amounts of sugars, salts, and fats. We're joined by Dr. Shukri Mohamed on the line. Dr. Shukri, thank you for joining us here on Channel Africa.
Thank you, Benjamin, for having me here today.
All right, let's come to kind of the backdrop of the study. Tell us a little bit about the context of why it was initiated.
So thank you for having me again. So the reason Kenya is considering having front-of-pack labels is because we have a rising burden of non-communicable diseases. We have hypertension, diabetes, and obesity all on the rise. From our recent Kenya demographic health surveillance survey, we found that overweight and obesity has actually increased to about 49%. And that's really alarming because our healthcare systems are not designed to cater for such a large burden of disease, given that we're already stretched as it is. So, and for that reason, we started looking at unhealthy diets and what can be done around unhealthy diets. And one of the strategies is to have a front-of-pack labeling system in the country that can help consumers in identifying unhealthy foods and help them guide them in making the right decisions when choosing their foods.
Yeah. Let's talk a little bit about the front of pack label. Usually we have those labels at the back of any item. Tell us a little bit about that adjustment. What is it? I've never seen a front of pack label, especially one that shows ingredients that are in a particular item. How would that actually look like?
So front-of-pack labels are labels. It's just a simplified label or symbol that in our original packages are usually in the back. So this is now simplifying what is the nutritional content that is in the back in the front. So they're usually put in the front, and they're designed to quickly help the consumer. You're communicating with the consumer on the key nutrients of concern. And some of the key nutrients of concern are like salt, fat, sugars, saturated fats. And so in a simplified way, you're telling the consumer that this product has these nutrients of concern. And so it will help them make healthier choices. So for instance, if you have diabetes and the product that you're selecting has high sugar, you're likely not to pick it because now you know that it has high. And so this would be symbols that would be put in the front of the pack, usually on one particular side.
And someone would say, well, this is just a small adjustment. It wouldn't really make a difference. What's the difference between this and a back of pack label? Is it any significant? Does it make any of a difference? Aren't we just looking at a small adjustment that people would continue to still ignore?
Not necessarily, because if you look at the nutritional facts that are on the back of labels, they don't really tell you, they don't really guide you in telling you that this product has high this nutrient of concern. But with the front of pack label, the added addition is that it does tell you that, this product has high salt, per 100 gram or per 100 ml, depending on what the product is. If it's a drink, it's per 100 ml, and if it's a food product, solid, it should be 100 grams. So by telling you that this product has high, while in the back of pack, what it tells you is that it has 50 grams of, this, but you have no way as a consumer, you wouldn't be able to know that this product is high in that particular nutrient of concern.
All right, fantastic. Okay, let's look at your study. What was your study actually doing? Did you guys go on the ground? Did you speak to people? What did the study actually entail in actually looking at this particular topic?
So our study was looking at testing 3 different labels, front of pack labels, to see which one would be best in helping consumers understand what the nutrients of identifying the nutrients of concern that are high in those products, and also whether it would help them in their purchasing decisions. So we looked at 3 labels that. One of them was a warning label that explicitly says that this product is high in, that nutrient of concern, so high in salt, high in sugar, high in fat. But in addition to that, we also had 2 other labels that had color coding, so sort of like a traffic light system. I don't know if you're familiar with traffic light systems. They usually have 3 different colors, but our particular one had only 2 colors, a red and a green label. So red would mean that that product is high in that nutrient of concern, and green would mean that it's within the thresholds that have been developed. And so we were testing to see how consumers would, which of the 3 labels would be most effective in, guiding the consumers in purchasing healthier products and in identifying that the nutrients of concern were high in those products.
Okay, we'll look at the findings after our break. It's very intriguing to see those type of labels, and I'm impressed at the fact that in your country you do have these different types of labels that have different kind of emphasis on its labeling, because we only have one type of labeling here in South Africa where we are broadcasting from. It's usually a back of label, and it's not really always that clear what is in the particular product. Looking forward to finding out what your study found in terms of its key findings. We'll be speaking to research scientist at the Kenya-based African Population and Health Research Center, Dr. Shukri Mohamed. In fact, she is on our live stream on our social media platform, so you can see her at Channel Africa 1 on YouTube as well on our Facebook page. Thank you, Doctor, for joining us there on that particular live stream. Ladies, welcome on the show. I see you, Dineo. I see you, Sboniso, but the gents are also there. Putejo is there, and Mokena is there as well. Thank you so much for joining us on the show. We'll take a break. We'll be back and have more of this conversation.
Benjamin Moshatama and Palesa on the move.
Do you know what is in your food? And can you identify whether or not the label tells you how healthy or unhealthy your food is? We're speaking to research scientist at the Kenya-based African Population and Health Research Center, Dr. Shukri Mohamed, who says it's more critical than ever for consumers to understand what's in the foods they're buying. This is after diet-related health conditions such as diabetes and hypertension have been on the rise in Kenya. And in a recent study, her and her fellow researchers are examining whether front-of-pack food labels could help Kenyan consumers make better choices. Thank you for staying with us, Dr. Shukri Mohamed. Let's speak a little bit about these labels and what they mean. So you spoke about the 3 types of labels that you used as an approach to this research: the red-green label, the red-green with icons, as well as the black octagon warning label. But what are you hoping to achieve with these different types of labels, and what are some of the observations you made on how people buy, or consumer mannerisms from the different labels that you used?
Thank you, Palesa, for also having me. So when we did the study, our results showed that regardless of which labels were used. Just having a label helped consumers in identifying nutrients of concern, which is good. But the participants who were looking at the warning label were able to better identify the nutrients of concern, and also they had also reduced intentions in terms of purchasing those unhealthy foods compared to the other two labels, which are the red and green labels. And so that what this shows is that having a clear, symbol that is easy to understand is also very important. So the three labels are not currently being used in Kenya, but we tested them to see how people would react to using any of those three symbols, and we found that the warning label was the most effective in identification of nutrients of concern, and also reducing the intention of consumers to buy these unhealthy foods in supermarkets.
That's quite interesting because many times, even without warning labels, we know when we're taking in things that are unhealthy, right? And we do it, I guess, not with that much intention, but it's because we are so used to eating certain types of food. This is what we like. This is what we enjoy. And people would change their behavior of those foods that enjoy simply because of the label. So what would the next step be? Now that we can see the warning signs and people might just change the consumer behavior in not purchasing some of the most unhealthiest food for them, how would you implement this on a normal basis?
So the label alone is not going to do it. And we all know that we definitely need to also include some education and public awareness. So there's going to be a role for the government to sort of help with educating and sensitizing the consumers once this front of pack label is implemented, because you don't want this symbol that is likely to help people to be misunderstood. So there's going to be a lot of work that needs to be done, particularly in public awareness, education. We can also think about how we can introduce this in the school curriculums. Students can be taught in one of their classes how to interpret some of these labels. And, a lot of times you'll find that it's the children who are usually asking their parents to help to buy these unhealthy foods. But now, if this is something that is in schools, being taught in schools, then the children will also know that, when I see this label, this means it's not healthy. So I'm not going to ask my parent to buy me this particular food. So there's quite a bit of work to be done. Advocacy groups need to also sensitize and have campaigns where they also educating the consumers on these food labels that will be adopted. Additionally, we're in a digital phase, so there should be a lot of social media campaigns on social media that can also help consumers in understanding the foods that they're buying once they're labeled with clear front of pack labeling systems.
Now, Dr. Mohamed, this is obviously something that needs to be implemented on a policy level, that these food stamps these labels are implemented, this education and awareness is taking place. But certainly there's going to be backlash from the food industry, because I doubt the food industry, who wants to sell their products, who uses these products as their business and the way they make money, will say, well, I don't want my particular product to have a labeling with a huge black warning sign on it. How are we going to be able to fight that back? Because obviously the food industry is a huge part of our economies all across the continent, and they certainly will be pushing back against something like this.
Yes, so thank you for that question, and it's a really important question because food industry is really important in helping us in implementation of this particular front of pack labels. But there's also an opportunity for them to understand and listen to the consumers and what they want. So for instance, it will be it will be also an opportunity for them to start reformulating their products so that they are not high in these nutrients of concern, and that will also help with reducing the diet-related diseases in the country. So they can take it in a positive way that obviously when the regulations or policies are going to be put in place, there might be a time where they'll be given some time to implement these policies, but eventually the opportunity that exists is that they will be able to reformulate their products, and based on, and that way they'll be aligning with consumer demand. So if consumers are demanding that their products don't have high sugar, it's only fair that the industry also starts reformulating their products so that we have a healthier nation, and consumers are able to select their products based on the nutritional quality that they have.
So what will be some of the long-term benefits of front-of-pack food labels, both in Kenya, but just in general, if this were to be implemented across the continent?
So if this is implemented, and what this is, we're reading from studies from other countries that have been done. They've been reduced purchase of unhealthy products that has been already been felt in other countries. We also have seen reduction in the obesity burden in some countries, and so with that, we are also likely to reduce our high burden of non-communicable diseases. There'll be also less stress on the healthcare systems, and that's what we're all aiming for, to have healthier population.
Well, thank you so much. Very interesting and insightful research here, and hopefully something that will help reduce the burden of our health sector here across the African continent, and of course, just to make people healthier in general. Thank you so much for your time, Dr. Mohamed.
Thank you so much, Benjamin and Palesa, for having me. Thank you.
That's research scientist at the Kenya-based African Population and Health Research Center, Dr. Shukri Mohamed, speaking about research done that examines whether front-of-pack food labels could help Kenyan consumers make better food choices.